Welcome to Business Connection. I'm Liz Spencer. We're on location today. We're at Pinnacle Dermatology, and we're here to learn about the importance of taking care of your skin. So tell me a little bit about your background.
Yeah, so I'm a board certified dermatologist. I trained downtown at the University of Illinois, Chicago. And then since then I've been in practice in the northwest suburbs for about 11 years. I didn't grow up here, but I've been here in the Naperville area for about 18 years and love this community. I'm happy to call this home.
That's nice. Tell me a little bit about your passion for dermatology.
Yeah, so initially what drew me to dermatology is it's a very visual field. So much of medicine is very, very abstract. So, you can't see the heart, but the skin you can see. And it tells you so much about your general health, your well-being. You can see signs of systemic diseases, you can have primary diseases related to the skin, and it's so accessible that you can really make a huge impact, treating skin.
I think many of us do not value our skin very much. We just think of it as, it's so resilient. You cut it, it heals, you move on.
Right.
And I think we also think about dermatology as just acne.
Sure.
So what else do we need to know about?
Yeah, so a huge part of my practice has been really focused on skin cancer, both helping patients prevent skin cancer and then also detecting and treating the skin cancers after, if there is a skin cancer. When you think about skin cancer prevention, a lot of the focus has been on sun protection, which there's a huge message to get across for that sun protection really can reduce the incidence of melanoma and non-melanoma skin cancers. So, wearing a daily sunblock SPF 30 or higher, wearing sun protective clothing. They've made huge advances with clothing, shirts, hats, sunglasses, all that can protect you really well. So now they've made these advances where these shirts actually come with a rating of a UPF, and that will consistently give you sun protection.
I think it's very interesting because most people, when we think about sun protection, we think about putting lotion on our face.
Sure.
But you really wanted it on our hands and our arms and our legs and our feet.
The face is definitely important, especially here in Chicago where you're going to take, for about 6 months of the year, all we ever expose is our face. So definitely a daily sunblock for the face is important.
Year round.
Year round. Because if you can see outside, then that's UV radiation coming through. So I think year round an SPF 30 or higher for the face. The rest of the body, if exposed. And so, as you said, hands, arms, legs, I think it's all important. Yeah, hats for the head, because the head is a common place to take a beating. So all over. And
with skin cancer and that, it can strike at any age. I think most of us assume that skin cancer is only going to impact the elderly.
Very, very true. So, we are seeing skin cancers across all ages. And unfortunately, the ages at which we're diagnosing skin cancers is getting younger and younger. And so I think it's important for everyone to be checked and everyone to do checks on their own. So making sure that you're looking over your skin once a month, looking for anything new or changing, sores or scabs or scales that just aren't going away. In kids, maybe having the parent take a look once a month. In couples, having the significant other help you out with that, or somebody that you trust to help you do that. But I think it's very important that everybody, one, gets checked by a medical professional, but then two, also is doing that skin check themselves to do some surveillance.
Right, and because we've heard about that, we've heard about moles and things like that.
Yeah.
But I don't think we think about really how important that is.
Sure. When we talk about skin cancer, we kind of divide it into two groups and think about moles and melanoma and then non-melanoma skin cancer. And actually, non-melanoma skin cancer is more common. The most common group, members of that group is going to be your basal cell and your squamous cell skin cancer. There are a few others. But the basal cell and squamous cells have a lot of relationship to sun exposure. So most commonly, you're going to find them in a sun-exposed area. As a sore or scab, a pink bump that just doesn't go away. When you think about melanoma, now this can be sun-exposed or sun-protected sites. So you're looking at moles both in areas that you have seen sun and areas that haven't seen sun. So the palms, the soles, other sun-protected sites. And kind of looking over for any new moles, any changing moles. Looking at, are they symmetrical? Do they have nice crisp borders? Do they have one color? Are they small on the edge of a pencil eraser? An old rule we used to use is the ugly duckling rule. Who does not look like everybody else? So things when you think about your moles that you should look for, and making sure you look at areas that aren't always exposed to the sun.
I think that's really good advice. So how do people get connected with you? Do they first go to their general practitioner and then there's a problem, or if they feel like there's a problem and they want to come directly,
Sure.
how do you?
Both. We're happy to see the patient after they've seen their primary doctor if there's a concern, but we're also happy to see you just if you spot something and you want to bring it to our attention, we're happy to see you that way as well. I think that a lot of patients will notice something on their skin that's changing, and I think it's important to get in a timely fashion and get that evaluated. The interesting part about skin cancer is that most skin cancers, if caught early, are very, very treatable in the outpatient setting. So I think if you see something changing, come on in, have us take a look, have us help you figure out what's going on.
That's wonderful. And I think overall, I think we just need to learn to value our skin a little bit more.
Agreed. Totally agree.
Great.
Agreed.
Thanks for taking time to tell us a little bit about what you do and the importance of our skin, and more importantly, the importance of taking care of it.
Well, thank you so much.
So Sarah, in addition to the medical dermatology that you do here, what else do you do here?
So once you've had your skin check and you know your skin is healthy, there's some things we can do to help you make you feel really great and confident and happy when you look in the mirror. And here in the Naperville office, we offer some Botox, we offer dermal fillers, and a product called Kybella. These are products that are used to help smooth fine lines and wrinkles, help replace volume loss, and also help define the jawline.
Wow. So tell me, we hear those terms and many women think about them, but when I come in the office, what happens? How does this all get started?
So the first step is to schedule a consultation, and we'll sit down and we'll talk about. I like to have people look in a mirror and ask them, what is it that bothers you most about your appearance? A lot of people will say, I look sad, or I look tired, or I look angry. And then we can talk about what changes are happening to their skin and their facial structure that are leading to those changes and how we can address them.
That's great. I think that's a nice way for somebody, whether man or woman, to come in and be able to explain what they're seeing, because our appearance, especially as we age, is tied to our self-esteem. So I think that's wonderful. Tell me a little bit. So we identify that I look sad or I look angry, and you're going to do something. Is it painful? Does it take a long time?
Most of these procedures are done, I should say all of these procedures are done here in the office in an office visit, 15 to 30 minutes at the most. They may experience some mild discomfort during the procedure, and afterwards perhaps a little bit of redness or swelling depending on the procedure. Usually doesn't last more than a few days.
That's wonderful. And I think many of us wonder, is this something they then do as maintenance for the rest of their lives, or how long does the procedure last? How many do you have to have?
It depends on the product we're talking about and the goals you're looking to achieve. I like to take a very natural and gradual approach. So, we can add little by little and kind of build upon that to where people feel like they've are feeling confident and happy about their appearance. Products last anywhere from 3 months to 4 months for Botox, and fillers last anywhere from 9 months to 2 years. So, and it's not something you have to do repeatedly. It's something you can see how you feel about, and there's no going back to worse than where you started. So things will gradually return to baseline.
Both women and more men now, we dye our hair, we do our eyebrows, and so this is becoming a natural extension of just looking and feeling a little bit better as we age. When people leave your office after a procedure, how do you think people feel?
I hope that they leave here feeling natural and confident and great about how they look.
That's wonderful. I'm sure they do, because you are so easy and natural to talk to. So thanks for sharing just a little time with us and telling what goes into all of this.
Thank you. My pleasure.
We'll be right back with more Business Connection.